Good morning to you all. It is both an honor and a privilege to stand before you today to speak on a subject that continues to evolve at an extraordinary pace. Recent advances in anesthesia. What was once limited to ether and chloroform has now become a sophisticated, multimodal, and patient centered science. The field of anesthesiology has not only revolutionized surgery but has expanded into critical care, pain management, and perioperative medicine. Over the next few minutes, I will walk you through some of the key advancements in our field, highlighting developments in technology, pharmacology, monitoring, and regional techniques, and artificial intelligence. Let's begin with pharmacology, the cornerstone of anesthesia. Recent years have seen introduction of short-acting, more predictable drugs. One notable example is remimazolam, a new ultra-short-acting benzodiazepine. It combines the sedative properties of midazolam with rapid onset and recovery of propofol without the risk of significant cardiovascular depression. Another promising molecule is semaglutide alpha, which shows neuroprotective potential and may eventually be used to manage perioperative neurocognitive dysfunction. Additionally, opioid-sparing anesthesia is gaining traction. With the opioid crisis looming large, anesthesiologists are shifting towards non-opioid agents like dexmedetomidine, ketamine, lidocaine, and gabapentinoids to improve analgesia while minimizing side effects. One of the most transformative developments has been in patient monitoring. Depth of anesthesia monitors such as bispectral index and entropy are now commonly used to prevent awareness under anesthesia, but today we have moved beyond just EEG-based monitoring. New devices like nociception level index monitor pain and stress responses under general anesthesia. By analyzing multiple physiological signals, it helps tailor opioid dosing with precision. Also, non-invasive cardiac output monitors such as ClearSight and NICOM systems allow real-time hemodynamic assessments without the risk of pulmonary artery catheters. Cerebral oximetry, another breakthrough, helps monitor brain perfusion during high-risk surgeries like cardiac or neurosurgery, reducing the risk of postoperative cognitive dysfunction. Focus. Another significant leap forward has been the integration of ultrasound into daily anesthesia practice. From vascular access and nerve blocks to airway assessment and cardiac evaluation, POCUS has become an extension of anesthesiology's stethoscope. It enhances accuracy, reduces complications, and improves patient safety. The use of ultrasound-guided regional anesthesia has become a gold standard. It has improved success rates, decreased local anesthetic doses, and minimized complications such as vascular puncture or nerve injuries. In critical care, POCUS allows quick assessment of lung sliding, pleural effusion, or cardiac tamponade, delivering life-saving insights in seconds. We have witnessed a surge in popularity of regional anesthesia techniques driven by their role in enhanced recovery after surgery, that is, ERAS protocols. The blocks like erector spinae plane block, quadratus lumborum, and PEX block have redefined our approach to post-operative analgesia. They offer prolonged pain relief with minimal motor block, making them ideal for ambulatory surgery and ERAS pathways. Moreover, the increasing use of patient catheter-based continuous regional techniques allows prolonged analgesia without systemic drug side effects, improving mobilization and reducing hospital stay. TIVA is experiencing a renaissance, especially with concerns surrounding inhalational agents and their environmental impact. With advanced target-controlled infusion pumps, drugs like propofol and remifentanil can be delivered precisely and safely. Emerging systems are being integrated with closed-loop feedback mechanisms that adjust drug infusions based on real-time data from bispectral index monitors or hemodynamic parameters. These automated anesthesia delivery systems reduce variability, improve patient outcomes, and might become the standard of care in near future. One of the most exciting frontiers is integration of artificial intelligence in anesthesia. AI algorithms are being developed to predict intraoperative hypotension, guide ventilator settings, optimize fluid therapy, and even anticipate difficult airways. Machine learning models trained on vast perioperative data sets can help stratify patient risks, tailor anesthesia plans, and provide decision support for critical events. Imagine an operating room where monitors don't just alert but interpret trends, predict adverse events, and suggest interventions. That's the promise AI holds today. While we strive for better patient outcomes, we cannot ignore our responsibilities toward the planet. Inhalational anesthetic agents like desflurane, nitrous oxide are potent greenhouse gases. There is a growing movement toward low flow anesthesia, use of sevoflurane, and a return to TIVA, which has a lesser environmental footprint. Innovations such as anesthetic gas scavenging systems and recycling technologies are also being developed to make our practice more eco-friendly. Anesthesiologists today are not just confined to the operation theatre, we are playing a pivotal role in perioperative medicine, from pre-operative optimization to post-operative pain and critical care. Rehabilitation programs involving anesthesiologists help optimize nutrition, control comorbidities, and reduce surgical risks. In pain medicine, advanced techniques like neuromodulation, radiofrequency ablation, and intrathecal drug delivery systems are transforming chronic pain management. Lastly, let us not forget the evolution of anesthesia education. High fidelity simulation training is now an integral part of resident program. It provides a safe environment to practice airway management, crisis scenarios, and team communication, enhancing both technical and non-technical skills. Virtual reality modules and AI-powered learning platforms are also making training more immersive, personalized, and accessible. To summarize, the field of anesthesiology is undergoing a technological revolution. From precision drug delivery and AI-based monitoring to advanced regional blocks and sustainable practices, we are at the forefront of innovation in medicine. But with great advancements come great responsibilities. As we embrace these new tools, let us remain grounded in our core values: patient safety, empathy, and evidence-based practice. Anesthesia today is no longer just about putting patients to sleep. It is about waking them up safely, pain-free, and better than before. Thank you for your attention.